At the onset, I'd like to thank Dr. Jayanta Kumar Das for giving me this opportunity to speak in his instruction course. So, good evening, everyone. My topic is a little bit hatke from the normal videos and all. So, I'll be speaking on the magnitude of lacrimal diseases in the community. So, the slide is not moving. Okay. I've got no financial interest. So let me first come to the dacroadenitis. It is a uncommon condition, and we find in 1 in 10,000 ophthalmic patients, mainly identified in children and young adults. So coming to the lacrimal gland tumors. So these tumors have a yearly incidence of 1 in 1 million, representing the 10% of orbital space occupying lesions. Here is the overall breakdown of the lacrimal gland tumors. 55% are benign and 45% malignant. Now we get nasolacrimal duct obstruction, the most common disorder of the lacrimal system, leading to the acute or chronic infection. So it has got a bimodal distribution. You can find congenitally just after birth or in adults more than 40 years. Now these are the conditions which can lead to epiphora. Now coming to the risk factors, older adults, females, patients with chronic eye inflammations, patients with eyelid surgery, nasal surgery, sinus surgery, patient undergoing radiation are at increased risk of nasolacrimal duct obstructions. Now coming to some of our studies, actually there are very limited data available. So this is a prospective study carried out in northern India by Khatun et al. So they found the prevalence of dacrocystitis to be 19.5 cases per 10,000 patients, and the incidence rate was 15 cases. Now they found chronic dacrocystitis to be more common. Majority of the cases were due to primary nasolacrimal duct obstructions. And they saw that the disease was very prevalent in the lower socioeconomic status, and housewives and farmers were more commonly affected. So this is another study done at Cuttack, Orissa, where they found the prevalence of chronic dacrocystitis to be 1.224%. Now this study was carried out at Hyderabad. It is in a tertiary care center. It is a retrospective study. They found the two most prevalent disorders are primary acquired nasolacrimal duct obstructions, followed by congenital. And the most frequently encountered proximal lacrimal disorder was punctal stenosis. Now here are two of the studies, one done at Odisha and another at Maharashtra. So both of them have highlighted that chronic dacrocystitis was more prevalent in 5th to 7th decade of life, and it was more seen in the lower socioeconomic status. And interestingly, housewives were affected more than secondly are the farmers. So all the studies have shown that the frequency of nasolacrimal duct obstruction was more prevalent in the females. So this is another study done at LVPI Hyderabad. It was a retrospective study. So mainly they found acute dacrocystitis comprising 2.4% of the patients. There was no difference in laterality, and 23 eyes presented with lacrimal abscess. So the mean time for resolution of the acute symptoms was 10 days, and 5.6% developed fistula. And there was spontaneous rupture leading of the lacrimal abscess, and dacrocystorhinosomy was performed in 82.5%. And they found that 2.8% had orbital cellulitis. Now coming to the microbiological profiling. Now this is a prospective study which was done at Karnataka, where they found that coagulase negative staphylococci and Staph aureus are the most common isolates. Now this is my own study which we did at Southern Assam, and we found that in chronic dacrocystitis, the main causative organism was Staphylococcus aureus and Pseudomonas. But in acute dacrocystitis, we found Staphylococcus and mixed flora. Now this similar study was done by Jayanta Kumar Das et al. In Northeast India, showing similar microbiological profile. That is, the majority was gram-positive Staphylococcus species and gram-negative was Pseudomonas. Now this study was carried out at Arvind Eye Hospital, and they did a retrospective analysis of the dacrocystitis patient, and they found that 30% had acute dacrocystitis and 70% had chronic dacrocystitis. And they found that Staphylococcus aureus and Pseudomonas was higher in acute dacrocystitis, while the proportion of coagulous negative Staphylococci was higher in chronic dacrocystitis. Now coming to the source of infection, it can be from the conjunctiva, it can be from the nasal cavity or nearby nasal sinuses. Now Joyanta Kumar Das et al. Had a publication and they have highlighted that the maximum growth was from the nasal mucosa, that was 90.7%, followed by the lacrimal sac and the conjunctiva. Now, all the studies have highlighted that the chronic dacrocystitis was more prevalent in lower socioeconomic status group. Why? Now, maybe there are poor workplace environment, no proper protective measures, poor hygiene among the patients. So it also contributes to their poor knowledge regarding disease condition and awareness regarding maintaining a good hygiene. And also, this is very important that poor socioeconomic status directly affects their poor affordability to health facilities. Now, this is a case of primary tubercular dacrocystitis, which was reported from a case of 15-year-old female with history of 8 months epiphora. So this is another unusual case of Epstein-Barr virus associated dacrocystitis. It was reported from 2 children in the United Kingdom. Thank you so much.